Hello everybody, this is Christina from Positive Change Counseling. Today I want to show you and talk to you about EMDR. Alright, I say it in my videos. I'm sure you've heard it around town or whatever about what kind of treatments there are for things like post-traumatic stress disorder, or PTSD, and the various and kind of saddening forms that it comes in, or what causes it. Okay, but either way, whatever the cause was, generally EMDR can be very effective. So what I'm going to do, I'm going to show you the EMDR room. As you can see, the background is blue. There's a lot more light in here than I would normally have, because so you can see my lovely face, and also so you can see the equipment and the paperwork and everything. So if you do feel like eye movement desensitization reprocessing is something that you want to try, or you want to suggest to somebody, this is basically what to expect. Okay, in my office, it's a little different, I guess, because I do have the dogs in different rooms, and kind of like the nice setup, and I think, but I do stick to the 8-phase standard protocol. Protocols at work I like very much. And Francine Shapiro developed a standard 8-phase EMDR protocol, and that's what I print out. I copy, I would follow it to a T, and basically ensure that when a person comes in, they leave in a better place emotionally. They find that catharsis and that some healing from when they came in. And some people need one treatment. I would suggest more than that, because that just kind of starts ruffling, what's in that room that we stuff our pain in. Just one I wouldn't really suggest, but it's not something that you need to do every week, because I think that might be kind of excessive. But it is very effective for lots of different forms of psychological and behavioral presentations, in that it's effective, and please look it up. So I don't want to be the one that gives you stats, because I don't want to be incorrect, but look up what else EMDR can be used for, and either way, the 8-phase is the general one to use anyways, so look into that. Do your own research on EMDR and PTSD, and how it works, and what to look for in a provider, and what to look for in the process. The biggest thing I will tell you is to look for someone that uses either equipment or hand gestures like we were taught originally, or something to actually cause eye movements, because that's kind of critical in eye movement desensitization. DR. EMDR has eye movements. If there's some sort of clinical problem of that you can't process, you can't move your eyes, okay, fine, we have the other bilateral stimulation with tappers and headphones, which I'll get into and explain that. But be wary of someone that says they can do it, but isn't certified, trained, or licensed, and also doesn't have the equipment, or any equipment, or any protocol, or really any method to stay true to the science of it. And I'd also look into the science of how EMDR and REM sleep and kind of the trauma and memory connection all kind of go together. I try to explain it, but of course it gets really complicated, and so I bore people. So I just say, just trust me, just go with it. But when I have a new person that's interested in EMDR, I obviously do explain it to them, because I want them to know what possible treatments there are to actually heal, instead of just the typical just talk therapy. Here in EMDR and trauma-informed care, I actually talk less. That took a minute to learn, right, for me. But no, in EMDR, I'm kind of out of the picture. I'm on the side. You just hear me for the most part, but you're not talking to me. You're kind of talking to the process. Okay, so that's actually why this room is the way it is. You'll see it in a second, but there's less clutter, less lights, and the focus is just you and the EMDR process. So, of course, as I was trained in grad school, for both masters, just trying to do was PowerPoints, okay, to explain how EMDR works. And since I really love science, and I really love trying to explain difficult and complicated ideas with pictures and like the importance of it, and just keeping it simple, keeping it where most people can understand what's going on, because I feel like medicine is so rushed, and it's all about the provider giving you, what you're going to do, and you don't even know what you're going to do, or who was your provider, and what just happened. That's not how I roll here, okay? I want you to know what therapies work for you, and what therapies are out there, medications, etc., etc. And if you want to do EMDR before you consent to it, and sign to it, and and all that good stuff, that you know what you're getting yourself into. It's not anything negative. It's just to help you understand when someone says, whoa, how does EMDR work? And you're like, well, I don't know. I just sat there and looked around. No, I want you to know at least a little bit of why it's working, how it's working, okay? And then I also have a checklist for the appropriateness for EMDR. It's not a one-size-fits-all, okay? And it doesn't just fix everything I wish, but it doesn't. So it's, for most people, it's rather effective. Again, you can look online or look somewhere, read a book, actually. Francine Shapiro writes books, or wrote books. Anyways, there are just some people that might not fit very well for how EMDR works. And that's just to protect them from any harm if they are applicable, in that they wouldn't be a good fit for EMDR. Doing EMDR wouldn't be ethical or safe. Okay, so it's just kind of like a little checklist. Like, are you highly dissociative? Do you have any kind of serious memory disorder or dementia, or things that would make it more of a challenge when it comes to how the science of EMDR works, and the machines and equipment and all that. Okay, then the consent, so and then basically the protocol. And I track the whole session. It's usually about a 90-minute session. It's also a lot of people charge, a lot of practitioners maybe charge extra, because it does take extra time, and it takes extra training, and it takes extra equipment, and it takes some dedication, really, and attention to deal with trauma as your focus. But if you know me, you know that I like taking on challenging situations. And so I've been very honored to be trusted to do this. And for the most people that have done it, it worked amazingly. And I'm not going to say it's perfect. I'm not going to say I do it perfectly. None of that. I just know that, honestly, as a nerd and as a psychotherapist, this EMDR process works for so much. And I'm glad to hear that, because in some cases they're at wit's end, So, okay, let's face time. Let me show you the stuff. Except for, I can't quite, I'm not as tech savvy as some people are, so some of the things are going to be a little silly. But anyway, let me do it this way. So, headphones. All right, you're going to put on headphones, covers, yes, you're not touching people's faces and makeup and all that kind of stuff. So these are reusable cotton covers. The headphones don't matter as long as you have two ears, if you have to, or if you're one ear, I guess you can do it that way. But anyways, one on each ear is the focus. Okay, it's plugged in to whatever equipment you're using to use the EMDR kit software. That's what I'm using, is the EMDR kit software. And with that, then you basically take over the session and can control the machine. So I am also it's called bilateral stimulation. Okay, bilateral meaning both parts of the brain and even the body, in a sense, are being kind of distracted enough. We do that on purpose. Not only is it kind of it brings you to the moment and brings you to a calmer state of mind, it also allows you to focus more because you're in the present, but it also distracts the part of us and in our psyche that is protecting the very painful stuff, that dark room that we all have. Some have it just pretty cluttered, and pretty dark, and the door's open. So, like I say, I come in there with you. I'm not scared of the dark room. I'll get rid of the stuff. Let's get through this. So, anyways, the standard protocol, all right, the 8 phase, headphones, tappers, you'll see what they do, and a light bar. So let me put, and we can modify the whole thing, okay? So modification of any of the lights or the headphones or what I listen to or what kind of stuff. So we can modify it depending on each person's interests. Sometimes my intro for the calm, safe place is certain biologically known sounds or frequencies that are known to be calming. And then here is the light bar. I want the light bar. Show me the light bar. Okay, so I would be looking at it, right? as the person, as a patient. Okay, so the headphones, the tapper's my hand, and I'm intent on focusing on my trauma and this weird looking experiment, but I promise it's had a lot of peer review support. Okay, so the light bar, headphones, and I'm thinking about what my practitioner is asking as what is dictated on the 8 phase standard protocol. Like, what do you want to work on, and what's happened to you because of it, and what kind of negative internal dialogue have you developed, and the habits and the behaviors from that, from this trauma or this event or this time or etc. Okay, so let's not get into all the things you can use it for again. Let's just say I'm just trying to show you the simple way that's done here in a sense. Okay, not really simple, but anyways. Okay, push start. All right, you hear that? All right, it's the headphones and it's the little tapper guy, one in each hand. And then the light bar is right there. I'm following it. I'm holding the tappers. And I'm thinking about, whatever the stimulus is, growing up, or this one situation, or first responders, or whatever. Again, colors and speed, etc. could be changed. The background wouldn't be so distracting. This is just to show you using light enough to show you, but it's usually dark enough to just see it, which is fine. So I'm over there, like I'm sitting on the side, and it's you and the dogs at your side. This is basically how they work. They just sleep, but it's wonderful because they're right there while you're processing some stuff. So, all right, and then I stop it, and then we take a deep breath, and then I ask you what you went through. I ask you what happened, what you see, what do you feel, and etc. etc. There's a lot of questions, and I am involved in it. I'm just not talking as much as I am now, of course, or like a regular session, and I'm also not in your visual field, so you can focus on what we're doing here. Okay, so anyway, that's the basic gist, I guess, of EMDR. I do use what I use because I want to really decrease how much anxiety and negative energy we live in. And so I find sources of good energy, of safety and of feeling safe. So a weighted blanket back here, fuzzy pillows, real loving, kind dogs, even a dog with the heartbeat in it, because like I say many times is maternal trauma could be some of the most difficult to go through. So the sound and the feel of a heartbeat actually scientifically again is known to support human kind of calming. That's why you hold babies, hold people, hold the dogs, connect, because that the rhythm of the heartbeat, telling you these wavelengths, man, and the more you learn about them, it's beautiful. But the rhythm of the heartbeat and the connection that has can be very healing. So I always try to incorporate as much as I can to get you better. Okay? All right. So I guess that's usually what happens. at the end of the session, it's kind of cleaned up and we've processed something, and most people have found a lot that they didn't know was even there, but it was released and they feel like this, weight lifted, their body feels cleared from, the trauma and the anger and whatever goes with it. And generally they sleep. The REM cycle helps kind of, do the fine tuning, and with more supportive work, whatever that means for each case, we can really, it can be a game changer is what I'm told, and it could be very useful in getting to things faster and more reliably than waiting for the right question or the right time in the pseudo. I mean, in the regular talk therapy sessions. Those can be useful too, but EMDR is a beautiful thing. Not the only way to heal, but trauma-informed care is becoming more aware of how to treat each other, because we're kind of making each other do terrible things to each other, and I don't want to talk about it. You don't want to hear about it, but there's some darkness, and it's again always us doing it to each other. So if we could stop doing that, then I wouldn't have to be doing so much EMDR. But it's the unfortunate truth is that we do hurt each other, and sometimes it can feel like there's no way we're going to heal, and that's not true. If we want to heal, honestly, in so many ways, if we really want to heal, we will, and our life can change from that. So every day we have the ability to make better choices and to be present and really try to do what we feel like is authentic to ourselves. So if you have any questions, please comment. I appreciate the very few of you who are listening, but I just wanted to be basically knowledgeable, helpful, and entertaining. All right. You guys take care of each other, okay? Bye.